Ideal patient is or a candidate is the patient who has something that we can change in the nose. For example, they have a bump or have something in the tip that we can modify, or the nose is twisted. So they have something that we can actually change by the technique. And the majority of the time, patients do have something if they're aware of it. So that's obviously the patient. Ideally, health-wise, healthier people, younger people obviously heal quicker and they go through the surgery easier. So healthy patients. It doesn't mean that people are unhealthy or not. Ideal are good candidates, but healthy patients are better candidates. Ideally as well, the people who don't smoke, for example, smoking is not very good for healing, so we prefer patients not to be smokers. And if they're smokers, they should stop smoking prior to the surgery, at least for a month, and ideally after the surgery, should come back to the smoking. Drugs that can cause blood thinning and things like this should not be taken as well. So things like this, patients should not be on blood thinning drugs like aspirin and so on. So these are the ideal patients. And one important thing is what we call realistic expectations. So the patient understands that in reality, there is a certain limit of what you can achieve with the nose operation. So the patients who are unrealistic expect something completely different from what we can achieve. They're not ideal patients. Rhinoplasty is very successful if you have assessed a patient appropriately and the patient understands the procedure. Success is very, very high. So I can't give you exact number, but I can say about 95%, 90%. Success means you get good results that the patient is happy with and the surgeon is happy with. And this happens in the majority of situations when you assess the patient appropriately and you've agreed what you expect from the surgeon. The success or the failure from opposite from success is when you have a complication and the nose hasn't healed the way expected, which can happen. Maybe 10 to 15% of patients can have that. And that's why some patients need revision surgery. It's important for the patient to stay healthy and eat well and sleep well as well. Avoid smoking. Avoid anything that thin the blood, because there are some medicines that thin the blood, like aspirin, Nurofen, things like this, so you shouldn't be taking them. Some people taking them for medical reasons, but they can always stop them for a week or so before the surgery, which we discuss with their own doctors. There are certain things that can thin the blood, like some products they can get over the counter, like alternative medicine, they can. So just have to make sure to read the labels, and anything that thin the blood should stop it. Things like garlic tablets, for example, people take for health, they can actually thin the blood, so we should stop all these. Otherwise, just the usual thing, which is just as we do with any general anesthesia, just be prepared for it. You have to fast with food and drink for about 6 hours prior to the surgery, and everything else is just as normal. There's nothing else you have to do. Don'ts, what not to do prior to the surgery: don't exhaust yourself, don't drink too much, don't be dehydrated, and as I said, don't take the drugs I explained earlier. Like any operation under general anesthesia, there are risks of anesthesia itself. Luckily, risks of anesthesia are so rare, extremely rare, so it's very unlikely, but every patient coming for an operation like this will be assessed for any risk of anesthesia. So the doctor who will put you to sleep will check them for allergies to anesthesia or any previous reactions and so on, heart and chest. That's why I actually don't see any problems from that, but will have to be discussed with the patients. Other things are related to the operation itself. Because it's a nose operation, the nose has a lot of blood supply, so it means it's very, very rich of blood supply. So there's some bleeding. Everybody gets some bleeding anyway, but to have heavy bleeding, that is a risk. But it's a very small risk as well, but the patients have to be aware of it. And if it happens, we can treat it. It's not a problem, but that is a risk. The second risk that the patient gets infection, because with any surgery, there's always some risk of infection. Infection can cause pain and pus and can decrease the good result or affect the good result of the surgery by the healing, because it affects the healing. So that's another risk. So that many of the patients need an antibiotic after the surgery to prevent this. The other risk is the nose doesn't heal the way as we expected. So you get unpredictable results, we call it, and that is something that exists with rhinoplasties. Not every nose will heal exactly the way that we want. So that is a risk that the patient needs a revision, and that is something that the patient has to be really aware of, because there's a chance maybe up to 10–15% of patient needing revision. It varies with the surgeon, it varies with the time of the surgery itself. but that isn't important, something to think about. There are some other small risks who are very rare, like changing in a sense of smell, which usually comes back, and numbness around the tip of the nose, which lasts a few months, even some irritation in the teeth that some patients get that also lasts a few months. This all comes back after. So after rhinoplasty, all the patient will have a cast or a plaster on the nose for a week. The important thing is the first 2 weeks, usually we advise the patient to rest and relax and not to go to work, because that's the time when you have bruising, which lasts about 2 weeks. The bruising usually disappears after 2 weeks. So some patient will have it for a bit longer than this. There's a lot of swelling on the nose itself, and the external structure of the nose, but also inside. So the nose from inside will get blocked, so that is initially, it's not very nice for blocking, which is probably during the first 2 weeks of recovery. There's also some blood and some discharge that comes from the nose for the first 2 weeks or so. So these are things that actually the patient will need to be aware of during the first 2 weeks of recovery. After the first 2 weeks, the nose slowly improves, but there's always swelling. The swelling of the nose from outside takes a very long time to completely disappear. Although a lot of the swelling will disappear in the first few weeks, it takes up to a year for the swelling from outside, especially around the tip area, to completely go away. So the patients have to be aware of this. As I said, also, some of the patients will have the bruising for a little bit longer than usual, but it always goes away.